best treatment is prevention. If you don't get it, you don't need to be treated, right? So today we are evolving through prevention, through AI, through medical technology. When I mean that, let's say in the region in GCC, we are talking about chronic disease and cancer, right? It's like, we have a great amount of chronic disease patients and cancer patients, unfortunately. So now what I see as a trend from myself is checking with a little bit of blood, a little bit of urine, if you have cancer or not, earlier than before. So we are moving toward preventing earlier through AI and medical technology, this kind of disease that we are seeing, treating earlier than expected, which is a great thing to do. So moving forward on this question, how do you see it here in the region? I'm not talking about just prevention, but I'm talking about virtual hospitals, digitalization of the hospitals, digitalization of the care. How do you see it in the Middle East evolving?
Yeah, thank you so much, because while you talk about prevention and having a small test that can tell that there is a potential of having a threatening disease, it came to my mind a real story from one of the hospitals here in Dammam, where they have adopted AI to read X-rays. And then one of the patients came after working hours to the ER, and they were suspicious that he is having a cardiac disease because he has short of breath, and if you have like a smoker with a shortness of breath and diabetes mellitus and a cardiac history, then most likely you will be looking around the heart and thinking that he has a heart problem. But the AI was pointing to the right lung where there was a lesion.
Oh. Okay.
And then I learned from the doctor who shared that story with us that in more than 70% of patients who develop lung cancer, it could have been that the initial lesion in the X-ray was missed few months back. And unfortunately, they have to wait until the tumor got bigger and until the consequences and the diagnosis and the treatment, of course, becomes more difficult. So this is a very good, real example of how adopting AI will help you, maybe not in prevention in this case, but at early detection. With early detection, you will have better treatment and very much higher rates of survival.
Absolutely.
Yeah, and I think just to add what he's saying, so I think the preventive part is very important. Like you mentioned, Manal, it's become more important for all of us. But the problem what we have to have a predictable analysis of what we are having as diseases is to have the right tool. And the right tool first is to have maybe biomarker who is showing you that if you have these diseases, you will have this biomarker, because it's all about diagnostic, in vitro diagnostics. This is why we are developing at the moment, especially in oncology, a lot of companion diagnostic to select first the patient, because the patient are not responding on the same way to all the treatment we are giving them. So if you are looking for the first thing to improve is the diagnostic. The diagnostic is a key in all our prediction of all the diseases, but it's helping us also to monitor the improvement of the therapy. So AI can just read something, but if you don't have the right biomarker, the detection methodology to do that, you cannot help people. And we missed, for example, a lot of mutation, and just between gender, for example. Woman was not detected having any cancer because they didn't consider the allotype for the gene what she had. So it was a false positive, a false negative, but in the end, the diagnostic methodology was developed with the mutation recognized by the man, but not taken in consideration the woman one. So this is important to understand that if you don't have the right biomarker, the right technology, the right methodology to diagnose the diseases, it doesn't help you to have AI or connected devices. So this is just a tool helping you to analyze some of the aspects of the data you have. And we need to make sure.
Absolutely, Fatima. This is where AI doesn't work by itself. You need to have doctors, we never will
But
remove
AI,
doctors
yeah.
and research.
Yeah, but AI is helping to
It's
scan.
helping. It's not
scanned a lot of,
replacing. Yeah,
you know,
absolutely.
images,
Gloria.
for example.
Hans mentioned virtual consultations earlier.
Yes.
There is an example that I read. There is a study out there. You can look it up. It's with Ping An, Good Doctor in China. They looked at 35.5 million consultations in 2020. And the most frequently asked questions are non-disease specific issues and moderate health problems like cold and flu. And what was quite interesting is 20% is gynecology related. And 60% of the people that are going for virtual consultations are female. And we were talking yesterday about how for endometriosis, it takes 14 years for someone to diagnose it. And it is women that get the disease and live with the disease for a very, very long time. And these are empowering patients to reach out, to ask for the help that they will probably otherwise never get or will never think they need. So it can, not only are you kind of, cutting the queues shorter for patients who are otherwise going into the hospitals and filling up emergency rooms, you're also enabling patients to ask questions and enabling them to ask things that they are otherwise scared to ask about, like reproductive health and so on and so forth. So in a way, I think digital health is just a great option, especially in the Middle East where there may be some stigma around female and women's health.
Thank you, Gloria. I didn't know about that. It's really interesting to
I'll send you the
on that,
paper.
right?
Yeah.
Yeah, thank
But
you.
I think gender gap is also a big topic. We will not
But
address
we're
it
not-
today.
it's not
in for the woman, because just the data are not available sometimes.
Yeah, but we are evolving toward that in the region, that we are more talking about women health and supporting women health in the region. I saw a lot within Saudi Arabia and also other countries in the Middle East. So we are moving toward that and early for women,
Correct.
early, so which is great.
We,
Khadija.
we also have to realize that the whole digitization and technology, role of technology, is part of the infrastructure for personalized medicine.
Absolutely.
As we evolve in the space, we need this. This is almost an essential ingredient because of the different pools of data. So if you are thinking of tapping into DNA data, the therapeutic options available data, the early detection and diagnosis data, these will be large data sets. And if you do not set up the infrastructure to pull from the right sources, we will be left behind from a personalized medicine readiness. So I think it's one of the building blocks for that.
Absolutely, absolutely right. Data, how to use it, how to put it right, which sources, how to make it tangible, and how to work with AI and doctors to move forward. Hans, maybe you want to add something on the virtual hospitals and what we're talking about here in the region and patient care?
Yeah, I mean, we've heard the essence, and let me polarize the discussion a little bit. I mean, we have all the ambition to go to prevention, but at the end of the day, it will always be a therapeutic field. And it's been mentioned, the early onset is the right issue, and personalized medicine starts selecting the right therapeutic option less invasively as early as possible. And I think the virtual hospital here in Riyadh, and honestly, everybody who hasn't seen it shall see it, because that's second to none in the world. The level of connectivity for 180 hospitals plus is really amazing. And it kind of accounts for the criticism that was brought forward when it comes to training, because that is an immense training tool also for physicians working in a peripheral setting that do not see rare diseases on a frequent basis. And the second element for the training is also, again, a digital element, because that's simulation.
Yeah.
I mean, once again, I trained as a surgeon. We had a little bit of a secret joke. When you go as a young surgeon to the OR and you meet your attending and he asks, how many times have you done that procedure?